Welcome my dear students to online classes. In this lecture you will see how cerebral palsy is diagnosed. That means investigations of cerebral palsy. It is diagnosed by जो cerebral palsy है, it is diagnosed by taking a complete medical history, performing a physical examination, that includes a detailed neurological exam, and also evaluating the signs and symptoms. Additional tests for the diagnosis of cerebral palsy that are performed includes EEG. EEG stands for an electroencephalogram. जो ये EEG है, this is used to evaluate the electrical activity in the brain. It may be ordered when the child is showing signs of epilepsy which causes seizures. Also, another test that is an MRI scan. MRI scan uses powerful magnets and radio waves. As you know, that is used to produce detailed image of the brain. It can identify जो MRI है, this identify any abnormality or injuries in the brain. Also, in addition to this, CT scan is performed for the diagnosis of cerebral palsy. CT scan creates clear cross-sectional images of the brain. It also reveals any brain damage. Another one is the cranial ultrasound. Cranial ultrasound जो है, that is also performed and is a relatively quick and inexpensive method to get basic images of the brain in the young infants, mostly in young infants. Also, blood is examined, blood test. Blood examination is done to rule out other possible conditions such as bleeding disorders. By this, cerebral palsy is diagnosed. Now, how is cerebral palsy treated? That is the treatment of cerebral palsy. The goal of treatment is to improve limitations and prevent complications. Treatment may include assistive aids, medications, and also surgery is done for the treatment of cerebral palsy. Now, in treatment, first you will see what are the assistive aids that are used for the treatment of cerebral palsy. That is, first one, eyeglasses. Hearing aids. walking aids, body braces, and also wheelchairs. As you know, जो ये cerebral palsy है, it is caused by abnormal brain development or injury to the developing brain. So, firstly हम लेते हैं जो ये cerebral palsy है, इसमें affect हो जाते हैं muscle movements and coordination. In some cases, vision may be affected. So, when vision is affected, assistive aids we are using for the treatment of cerebral palsy, that is eyeglasses for vision impairment. Or there may be also hearing loss. So, hearing aids are used. And also for movements, walking aids are used. For postures, maintenance of alignment, that is body braces are used. And for coordination and other body movements, muscle movements, wheelchairs are used. These are the assistive aids. Now you will see the medication. In medications, oral anticonvulsants, and muscle relaxants are used. For the treatment of cerebral palsy, जो हम इसमें medication use करते हैं, medication में क्या use किया जाता है? Oral anticonvulsants and muscle relaxants use किए जाते हैं. These are commonly used as a first line treatment. This is the first line treatment for cerebral palsy. Oral anticonvulsants and muscle relaxants. जो इसमें हम यूज करते हैं anticonvulsants and muscle relaxants, that may be diazepam, dantrolene, tizanidine. These are commonly used oral anticonvulsants and muscle relaxants. Also, doctors also suggest local injection of botulinum toxin type A injection. Also named as Botox injection is given to the patient, or intrathecal baclofen therapy. Where drug is intrathecal baclofen therapy भी दिए जाते हैं. Intrathecal baclofen therapy हम किसको बोलते हैं? Where the drug is delivered by an implantable pump. This is the medication used for the cerebral palsy. Now you will see the surgery. For cerebral palsy, orthopedic surgery may be used. सेरेब्रल पैल्सी के लिए कौन सी सर्जरी की जाती है? ऑर्थोपेडिक सर्जरी की जाती है. दिस इज यूज्ड किस लिए? टू रिलीव पेन एंड इम्प्रूव मोबिलिटी It may also be used. जो ये ऑर्थोपेडिक सर्जरी है, that may also be needed to release tight muscles or to correct bone abnormalities caused by spasticity. ऑर्थोपेडिक सर्जरी में कौन सी सर्जरी करते हैं? SDR might be recommended. SDR surgery. SDR surgery means selective dorsal rhizotomy. This is the SDR. Selective dorsal rhizotomy might be recommended as a last resort to reduce chronic pain and spasticity. इसमें क्या किया जाता है? इस सर्जरी में, SDR सर्जरी में क्या किया जाता है? It involves, इसमें नर्व्स को कट किया जाता है, कटिंग ऑफ नर्व्स near the base of spinal cord. This is the selective dorsal rhizotomy. It involves cutting nerves near the base of the spinal cord to reduce chronic pain and spasticity. Other treatments also includes for cerebral palsy. Other treatments are also used. What are those other types of treatment? Other types of treatment, that is the speech therapy, physical therapy, occupational therapy, recreational therapy, social service consultants, etc. Although stem cell therapy is being explored as a potential treatment for cerebral palsy, but for that therapy, stem cell therapy जो इसमें use की जाती है, research is still in the early stages. So this is the treatment of cerebral palsy. By this concludes the topic.